Welcome to 20-Minute Health Talk. I'm your host, Rob Hoyle, alongside my co-host, Chris Gazewski. Today, our special guests are Dr. Soteri Polidoro. He's the Medical Director of Addiction Services for Northwell Health. And joining us virtually today on Zoom is Dr. Herschel Karani. He's the Medical Director of Wellbridge. Thank you so much for joining us. COVID has affected people in so many ways. It's been such a tough year. And one of the things that we're seeing is a rise in addiction. So just tell us what is happening and what is happening with people turning to substance abuse.
Sure. Thank you, Rob, and thank you, Chris, for being part of the conversation. It's been really a rather difficult year for so many, for people in our communities, for families, for our nation, for the entire world during this pandemic. And so I think, many are certainly working to continue to be flexible and adaptable during these very difficult times. And like everyone else, some people who have had a history of substance use have been triggered by the process and have that added strain and difficulty has led to more difficult challenges, potentially related to picking up using. Certainly, there have been many people who have started to drink or started to use drugs in ways that can be harmful. And so these are the types of things that we've been thinking about and concerned about, certainly over the past year. And we've started to see some very concerning trends, some trends that indicate these increased risk of use, increasing use, and really, really sadly, particularly increases in the number of overdoses that we've seen. And so that's a really kind of tragic information that we've started to see over the past year in areas that we are very focused on trying to address to make sure that people who are struggling, people who just want to understand, how potentially different substances are affecting them, to kind of learn more and even consider treatment if that's something that's appropriate, that all those avenues are available to people in ways that are accessible to them.
Is this a result of like high anxiety and the isolation and people quarantining? Is this a result of that?
Well, part of it certainly is related to the stress that somebody is experiencing, how they're dealing with sometimes some of those stress and some of those hardships. But it's important for us to consider really what an addiction is, and the way that we understand an addiction is that it's a treatable chronic illness that encompasses a number of different factors, including physiologic factors, genetic factors, environmental factors. So, Chris, when you note kind of the stress and some of the triggers, certainly that would be an environmental factor. But what we also understand is that it is particularly characterized by sort of compulsive drug seeking and use, despite a number of negative consequences. So simply the stress doesn't necessarily lead to all those other factors, but could be a component for some people.
Dr. Herschel Karani, Medical Director of Wellbridge, who's joining us via Zoom. Tell us a little bit about Wellbridge and what it offers.
Hi there. Thank you both for having me. And I certainly want to echo some of the challenging issues that Dr. Polidoro is raising. I'll start by just framing a little bit about what Wellbridge is. We're the product of almost 10-year effort on the part of Northwell Health in joint venture with Engel Berman, which is a private real estate development group in Long Island, and the founder of Wellbridge, Andrew Drazen, to bring forward a remarkably new approach to addiction care. And in so many ways, in a broader arena of addiction, I'd say that one of the critical questions and open challenges remains, how do we engage more patients? And I think from the very design of Wellbridge, we're trying to destigmatize, eliminate some of the unfortunate caricatures that still dominate what addiction care looks like, and creating an environment that really honors the dignity of those that are struggling with substance issues, and really hopes to invite their families into the process from day one. So really the core vision of Wellbridge was to bring forth a learning laboratory where science would be directly integrated with clinical care. That as clinicians are encountering issues, bringing them to our scientific team, that solutions, strategies can evolve within the research framework and then lead, certainly over time, to tangible, actionable treatment strategies.
Dr. Khurrani, so with addiction rising amid the pandemic here, is there anything people who are suffering, is there anything that they can do?
Absolutely. In many ways, the hallmarks of effective recovery strategies focus around creating structure and supports in one's life. And the pandemic, in so many ways, really exquisitely disrupted those very foundations of recovery. What we've observed in Wellbridge is that many of individuals that were actually doing well or stable in recovery started to encounter a lot of disruptions in the supports that they relied on, which culminated in relapse and seeking higher levels of care. And finding the ways to reconnect with those supports is one of the essential functions that we have to offer. So I think for folks that are in the kind of early phase of either identifying potential challenges with substances, to start by just getting informed. There are an array of resources online. The ones I most commonly refer folks to would be large government agencies like National Institutes of Drug Abuse, NIAAA, which focuses on issues related to alcohol, as well as SAMHSA. So these are just great repositories of information to learn more about substance use patterns, but also to find treatment resources that are available within their local communities.
Yeah, I think one of the problems with substance abuse is a lot of times people who are having the problems don't think they're having a problem. And so how is it for family members or friends or coworkers to approach that subject and say, hey, is everything all right? Is it as simple as saying, hey, is everything all right?
So Rob, that's a great point. And sometimes it is really just opening up a conversation. Again, it's so important to recognize that an addiction really is a chronic relapsing disease. And so having an open, non-judgmental conversation, recognizing the huge impact it could be for that person, the way that another illness can certainly be for a person, and have that conversation, provide the support, and really relay, again, some of the resources that Dr. Khurrani was able to articulate very clearly, that there are so many resources that are available. There are online resources, things like findtreatment.gov, which is part of a larger government group that can identify treatment programs throughout the entire country. So irrespective of where somebody is, they can access care that is local to them and start that conversation. That conversation can be had with their local healthcare provider, be it a primary care physician or other mental health provider, again, to be open and transparent about some of the challenges, or simply having a conversation to see if it is a challenge.
What about at Northwell? I understand, we've ramped up telepsych services through this pandemic. Is that also playing a role here?
So very much so, Chris. The pandemic had impacted so many of us, particularly starting in New York in the spring of last year. And that led to a very rapid transition for all of our substance use specialty programs. And within Northwell, we have over 10 programs that are geographically throughout the area that Northwell serves. And all of our outpatient programs rapidly incorporated telehealth into their services. And it was certainly at that time a particular challenge because frequently care for substance use disorder